hygiene first. Knock knock. Hi, Miss Ledesma. I'm Jocelyn. I'm going to be your nurse for today. How are you doing?
I'm good, thank you.
So what brings you in today?
I'm here for a physical.
Physical. Okay. Do you have any complaints right now? Anything hurting? Anything bothering you that you would like to address in this visit today?
No.
Okay. So just a couple of questions. Do you have any medical problems?
No.
Okay. Do you have any allergies to medication or food?
No.
Okay. Does your family have any medical history?
Cardiac history and diabetes.
Okay. Dad's or mom's side?
Mom's side.
Okay. And social history, are you a smoker?
No.
Do you drink alcohol?
Yes.
Okay. On a daily basis?
No, socially.
Okay. What about any drugs?
No.
Okay. And moving on with that. Oh, do you have any cultural preferences that you would like for us to address today?
No.
Okay. If we had to give you a blood transfusion to save your life, would you accept that?
Yes.
Okay. And any religion that you currently address, what you associate yourself with?
Catholicism.
Okay. Are you currently active in your practice?
Yes.
Okay. All right. So Ms. Ledesma is alert and oriented. She looks well nourished. She is well appropriately dressed and groomed, and she's in no acute distress. Moving on. So we're going to start with your head. Okay. I am checking for symmetry in the eyes. I'm checking for ear symmetry. I'm looking for any abnormalities, any deformities. Once I'm done with that, I'm going to go ahead and palpate. So I'm going to palpate her head. Make sure that there's no deformities noted or abnormalities. I could also start palpating her sinus, starting with the occipital sinus in the back, moving to the front, palpating her lymph nodes, going down the cervical into the subclavicular. And I'm also going to palpate her TMJ. Go ahead and open your mouth and then close. Any pain with that?
No.
Okay. I'm going to now have you cover one nostril with one. Okay, now blow. Okay, now with your other finger cover. Okay, blow. Nostrils are patent, no complications. I'm going to have you smell these two items, and you're going to tell me what it smells like, okay? You smell that?
Chocolate.
Okay, what about this one?
Lemon.
All right, so sense is intact. Now I'm gonna have you open your mouth, stick your tongue out for me. Okay, I'm shining my pen light in her mouth, okay? And uvula looks midline, tongue is symmetrical and midline. The mucous membranes are pink, moist, and there's no abnormalities, there's no missing teeth, there's no deformities in the mouth. Now I'm gonna check for gag reflex. Okay, so say ah, okay. Gag reflex is present. Now we are going to, I'm gonna check your hearing, okay? So I'm going to whisper something on both sides, and you just tell me what I'm saying.
Okay. 1, 2, 3.
Okay?
1, 2, 3.
Okay, so hearing is intact. Now we're going to do respiratory. So just for this part, I'm going to have you remove your gown just so I could inspect and also listen, okay? So for respiratory, I'm inspecting the back. I'm going to look for equal rise of the back and both anterior and posterior. I'm going to look for any abnormalities, any deformities. The skin is intact. And she is spontaneously breathing at about 16 rates per minute right now. No distress noted with a regular depth. I'm going to listen to her lungs now with my stethoscope. Okay? Take a deep breath. Deep breath. All right, so lung sounds are equal bilaterally. No adventition sounds heard. She does not have a cough. So we are going to go ahead now and move on to cardiovascular. So cardiovascular, I'm going to check her cap refill. So cap refill is less than 3 on both upper and lower extremities. Her skin is warm, dry, and pink. I'm going to check for pulses. Pulses are equal and strong +2 on the radial. Equal +2 and strong pedal pulses. Anterior tibia pulses are +2 and equal on both sides. And now we're going to listen to her heart. So I'm going to listen to four parts of her heart, 4 sections, I'm sorry. So I'm going to listen over the aorta. Then I'm going to listen over the pulmonary arteries. Now Erb's point, that's going to be her tricuspid valve. And then the mitral valve, right at the apex of the heart. So I'm listening for an audible S1, S2, making sure that there's no murmurs or gallops. She has an audible S1, S2. S1 is heard the loudest at the base of the heart, while S2 is heard the loudest right at Erb's point. We're going to check her abdomen now. Oh, I'm sorry. No edema is noted in her lower extremities either. So we're going to check her abdomen now. I'm going to have you line all the way back. So we're going to listen to all 4 quadrants with my stethoscope. I'm listening for bowel sounds, making sure that they're all present. Bowel sounds are all present in all 4 quadrants. Now I'm going to go ahead and palpate for any abnormalities, any large organs, such as a liver or spleen. Any pain while I palpated? No?
No.
Okay. So now we're going to percuss the abdomen. Sounds are dual. Now to check for the size of the liver, we are going to start mid-clavicular down in the abdomen, and we're going to make our way up. Until I hear the sound change, and then we're going to start from the top, mid-clavicular, and we're going to make our way down. Make sure I mark those spots where I heard the difference in the sound, and measure those 2 spots, and that's going to be the size of the liver. Moving on to neurovascular. So we're going to, I'm going to have you bring your heel to your knee and slide it down your shin. Perfect. The other one as well. Perfect. And now you're going to touch my finger and touch your nose. Okay, touch my finger, touch your nose. Perfect. And then with the other hand, touch my finger, touch your nose. Perfect. So no limitatia is present. I'm going to have you squish my fingers. Okay, now push me. Now pull me in. Okay, and then go ahead and lift this leg up in the air. Okay, what about this one? Okay, go ahead and push against my hands. All right, so she has effort against gravity on all 4 extremities. Her grip is strong, and strength is equal bilateral on both upper and lower extremities. I'm gonna have you sit up now. So now that I have her sitting up, I'm gonna check for CVA tenderness. Okay, so I'm gonna go right up above the ribs, and I'm going to just tap. Any pain?
No.
Okay, so negative on the CVA tenderness. And now we are going to, I'm going to have you stand up. We're going to do the Romberg test. So you are going to close your eyes and put your hands up in the air. All right, negative Romberg. And now you are going to bring your heel to your toe, and you're going to walk in a straight line for me and back. All right, go ahead and turn around. Perfect. So patient has a steady gait with tandem walking and steady gait overall. Now you could go ahead and touch your toes for me. Okay, I'm going to feel your spine. So we're checking, make sure that it's linear. There's no step-offs, no deformities or abnormalities are noted. Okay, go ahead and come back up. Now you're going to go to the side. You're right, now to your left. And now you're going to go back. Perfect. Then you could go ahead and relax. Now range of motion is intact in the spine. No abnormalities. Now we're going to check your Babinski reflex, okay? So go ahead and sit down. Okay. And have a negative Babinski. And last but not least, I forgot to check your vision. So I'm going to have you cover one eye for me. Okay. How many fingers am I holding up?
1,
Okay.
2, 1, 2,
Okay, now cover the other one.
1, 2, 1, 2.
So peripheral vision is intact. Now we're going to check for any strabismus. Look straight at my shoulder. All right. Straight at the other shoulder. Perfect. So no strabismus noted. Now follow my finger, just with your eyes. All right, so no abnormal extraocular movements are noted. And I'm going to check for pupils now with my pen light. So you're going to close your eyes for me. Open them. Perfect. Close your eyes. Open them. Okay, now follow my pen light too. Perfect. So pupils are equal, red, and reactive to light. The sclera is white. No abnormalities noted within the iris. All right, Lauren, do you have any questions for me?
No.
Okay, well, good luck.
Thank you.
You're very welcome. Thank you.